Venous disease can certainly become pathologic. Oftentimes, it may just end with some heaviness and cramping to the legs, but progressive swelling that goes unchecked can lead to ulcerations of your skin, and this can be quite difficult to treat. These particular ulcers tend to happen along the medial malleolus or on the inner part of your ankle. These are classic for being secondary to venous reflux disease because you just have so much swelling to the leg that your skin surface just isn't seeing the nutrients that it needs to. While compressive therapy is excellent in treatments of this, sometimes, again, you do have to go after the underlying cause, which is the venous reflux, which we identify at the time of initial evaluation that can potentially help treat the disease. So the legs are composed of muscle, veins, arteries, bones, joints, and certainly when you have lower extremity discomfort, any of the above could be the culprit. With venous reflux disease, certainly we do have our typical symptoms, which includes cramping, pain, swelling of the legs. Certainly you do have the cosmesis effects of it with the bulging veins and the spider veins. Spider veins may erupt spontaneously, but most oftentimes they erupt because there is a bigger force behind it that is allowing it to come to the surface. And so this is why a formal ultrasound evaluation is important for us to identify if you have any underlying deeper venous reflux disease that we need to go ahead and treat before we go after spider veins. I do want to highlight though that sometimes if it is not the veins, then we do warrant more investigation. Some people can have natural swelling of the lower legs, which may be secondary to lymphedema, in which we can go ahead and refer you for treatment as well. Lower extremity swelling can also be because of just generalized health conditions. Poor kidney function that leaks protein into your urine. Congestive heart failure can lead to lower extremity swelling. Typically, though, this will be a little bit more diffuse, meaning you're seeing it in other areas other than your lower legs, arms, or such. But if it is just generally isolated to your lower legs, please see us to make sure it's not your veins. The internet offers a lot of information, and I'm sure people spend a lot of time trying to figure out why their disease is such and trying to figure out what they need to do about it. Please do not hesitate to call our office to come in for evaluation. Certainly, we do have on-site ultrasounds so that we can go ahead and take a look and evaluate and in real time interpret your results so that we can offer you optimal treatment plan if it is indicated with us. Here at Paragon Surgical Specialists in Vein Care, your treatment is handled by board-certified surgeons. This means that us as surgeons, if anything more invasive than the generic laser therapy or injections is required, then we are more than apt to handle it. Any complications that may happen as a result of our procedures also, we are more than adequate to handle. So please entrust your care to Paragon Surgical Specialists in Vein Care.